Hello everyone, this is Alraies from Phoenix in SCAI 2023. I'm really privileged today to be with Dr. Eric Secemsky. He's one of the late breaker presenters at SCAI 2023. Eric, thanks for being with us.
Thank you for having me.
Yeah, so you are going to talk about CLI and how to implement that in certain population. Can you tell us about the hypothesis of the trial and the idea?
Yeah, absolutely. So one of the most important clinical trials just resulted in the vascular space, which was called BEST CLI. And in BEST CLI, the investigators randomized patients with chronic or limb-threatening ischemia or critical limb ischemia to either an endovascular or surgical revascularization strategy. And in the BEST CLI trial, there was a benefit for undergoing a surgical venous bypass as a primary treatment option for CLTI. A lot of questions remain, though, from that trial. A big part of it was, who are the patients who made it in the trial and who are the patients who didn't make it in the trial?
Right.
How does this trial results apply to an older population, such as the Medicare population, of PAD patients that we take care of every day? And do outcomes mimic in the Medicare population what was seen in the clinical trial?
Yeah, and that's very important because there's diversity of practice and you cannot implement one study findings on everybody. It's not one size fits all.
That's exactly right. You know, we live in, unfortunately, a little bit of an evidence desert in the vascular space where there hasn't been a lot of clinical evidence.
Yeah.
So as this trial is critically important for the field, it's also notable that it's hard to represent how broad the field is, the operators who specialize in this practice and the patients who are treated around the country.
Absolutely. So tell us about the results.
Yeah, so we found some really interesting findings, and I don't think many of them are too surprising, but it's really nice to get some evidence out there just supporting what we have been hypothesizing. The first is obviously the Medicare population is different than the BEST CLI population. They're older patients, they have more comorbidities, and we know that they often have worse outcomes because of this.
Yes.
Because of that, we saw that endovascular outcomes in people with CLI treated in the Medicare population closely mimic the outcomes seen in BEST CLI, but our surgical outcomes were a little bit worse. And again, that's not something to be unexpected as these are older patients who have more comorbidities.
Right.
I do think it was notable that there are a lot of patients who were treated during the study period who were not in the BEST CLI trial. And these were even at specific sites who enrolled in the trial. And again, it just shows you that it was really hard to find the right population that had equipoise between surgical and endovascular treatment in BEST CLI, and the majority of our patients do not have that. Majority of our patients kind of have a pathway ahead of them where surgery is not a great option. We're just going to really focus on the endovascular treatment, or vice versa. And so we were really able to capture that nicely in this study.
Absolutely. So congratulations for the findings. So do you think, based on your findings, you can extrapolate the finding of the trial to other population, or you think each population should be studied differently?
Yeah, I think that this study really is meant to be complementary to the BEST CLI finding results. I think BEST CLI reminds us that surgical venous bypass is an important treatment option for the CLI population, and we probably underutilize that right now.
Yeah.
But I do think that we need to tailor our approach to patients based on many considerations, not a one-size-fits-all. There is preferences of the patient, the risks of each of the procedures, the goals. Are they going to want to be in the hospital for a few days, or they want to be out the same day?
Right.
And many different options that go into how do we get the best care to each individual patient to really get them to the outcome they need.
Awesome. Congratulations, Dr. Secemsky, for the great results. Please watch these videos and other on SCAI-TV. This is Alraies from SCAI 2023. Dr. Secemsky, again, thanks so much.
Thank you very much. Appreciate being here.